And without further ado, it is my pleasure to introduce Aaron Stocks from our national office. He is the Compass Operations Manager. And I'd invite Aaron to share a little bit about himself, and we'll move into our presentation. So Aaron, I'll turn it over to you.
That sounds great. Well, David, thank you. When you originally reached out and we talked to Jackie, Jackie Henry, who coordinates all of our outreach, I love to jump at these opportunities because it's nice to know that life still exists outside of my own household and outside of my own team. So whenever I get a chance to do some of these presentations and talk about all the ways that we can help the community, I love to make this as interactive as possible. If you have questions or if something doesn't make sense whenever I'm talking about one of the slides, please bring it up. I want everyone to get as much as you can out of the presentation. And of course, you don't know what you don't know. So feel free to ask questions, and I'm happy to take a pause or answer questions at the end. But David said I'm one of two operations managers with Compass. I actually had the pleasure to start out as one of our case managers when we first started this whole idea of being able to help people on an individual basis. There were two of us, and now we have a whole team of case managers, and we'll talk a little bit about how we divide up our work and how we want team members to be a subject matter expert. But we have grown. We're always looking for new ways to help the community. I've been with the foundation it will be 13 years in January. The first job straight out of college. I actually started with our Metro DC chapter. And then whenever this idea of being able to help people on an individual basis kind of got started, I jumped at that opportunity, and definitely where my passion lied. And obviously the CF community is very, very close to my family and close to my heart. So why don't we get started? I want to give plenty of time for any feedback, any questions. If you have something that's going on for you personally, we can always connect afterwards. We're gonna have a slide that has contact information in the chat. I'm happy to share my email. So if it's something that you want to talk about offline, feel free to reach out. Next slide, David. All right, so what is Compass? If you've never called us, if you've never reached out to us, Compass is a service that we provide for the CF community to help people on an individual basis in these specific areas. Insurance, which we'll get more into a little bit later, but I always say it's like our bread and butter. Insurance is one of the most complicated concepts that I think exists in this country. I think our former CEO, Preston Campbell, he used to tell us that he knew people with 2 PhDs that still don't understand health insurance in this country. And I think that's fairly accurate because it is extremely complicated. The category that we call financial is anything that helps paying for direct care. So being medications, therapies, durable medical, any type of service associated with paying for healthcare. Legal, pretty straightforward. For some types of cases, we will refer to the CF Legal Information Hotline. We'll get into that a little bit more. I'm sure lots of people are familiar with Beth Suffian and Passamano, law firm down in Texas. She's been an incredible advocate for the CF community for a very long time. And then other, we'll talk about that a little bit later as well in a different slide, but other is pretty much the sky is the limit as long as it's within our scope of services, which I can touch on as well. Perfect. For a very long time, there was this misconception that Compass has eligibility criteria. So we've gotten feedback from people in the community to say, I've heard about Compass, but I've never reached out to them. I don't think that we would be eligible. I think it's always important to share information about eligibility, which is it's open for anybody who has CF. We do not have household size or household income guidelines. It's for people who are pre and post transplant. We can help any family or household as long as it's going to be a direct impact for the person with CF. And then we also work very closely with our care teams. Obviously, whenever health insurance comes into play and submitting prior authorizations and appeals and finding out what's going on with an insurance, the care team's jobs are to take care of the people with CF. So anytime that we can alleviate some of that time or that burden with the insurance company, we want to be there to support them as well. We have no insurance, no income or care center criteria, meaning you do not have to be seen at an accredited care center. If there is some other physician or team that you're seeing, does not matter. The one thing that I also like to include in this slide that's not listed is it does not matter if you are a citizen or a resident of this country. We will help either way. Encompass is free and confidential. Next slide. All right. So here's our contact information. And at the end, as long as I don't forget, I will also include my email just in case questions spark and you want to connect afterwards. I'm happy to make myself available. But these are the ways that we have currently for people to reach out. We have an online form, which is great. That's a great way for us to collect as much information as possible, especially maybe after hours, to initiate a case with us. Very important about the online form. It's very similar to some of the other websites that we sometimes direct people to. It's a two-step process. Whenever you go to the online form, you'll have to create what's called an account, so a username and password. At that time, that means you can get into the system. You haven't necessarily created a case for us yet. So once you create that username and password, it's almost like an application process just to collect some information about what we can help with afterwards. So just be sure if you're trying to submit something, you're not quite finished yet. Whenever you create the username and password, move forward with the application process too, to make sure that we can get to you as soon as possible. But as of right now, obviously we have our phone lines open from 9 to 7. We are considering expanding that out just to be able to give people on the West Coast and Central Time the same opportunity as people on the East Coast to be able to reach out to us. As of right now, on Fridays, it's just 9 to 3 p.m. since the foundation closes down a little bit early. We have our general email inbox. We talked about the online form, and we are looking at other ways to expand out for people to be able to reach out to us. We're thinking about things like online chat and a texting service. So again, we're always trying to find better ways to service the CF community. Next slide. All right. And these are the people that make the magic happen. This is our amazing case management team. A couple of things to point out. The two ladies with the stars, there are bilingual case managers. So they speak fluent Spanish. But however, we do also use a service called Language Line, recognizing that not everyone speaks English, and Spanish is a very high population for people with CF, but there are also other languages. So we do use a service called Language Line as well if we need to speak to someone in a different language like that. So these folks, they are assigned specific states throughout the country. The idea for that is very early in our stages when we were starting case management service, we had a couple of people who were expected to know everything in the entire country and be connected with the different resources and build relationships with the care teams and with our chapters, right? We all want to collaborate and work together to make sure that we're providing the best service that we possibly can for the community. But we quickly realized that that's a lot of information for people to learn. So we started assigning our team members specific states so that way we could really hone in on the information, build relationships with our care teams, know every in and out about the programs that are available in specific areas to ultimately give better service to the people living in those areas. So next slide, David. All right. Any questions so far? Anything in the chat, David?
Let me check. Oops. Nothing yet.
All right, we'll keep on rolling. All right, so the other great thing that we're doing now is we're starting to look a lot at our data. So we use a customer relationship management system. to kind of keep track of what types of cases or what are the needs of the CF community all over the country. Are there specific things that are happening with insurance companies in certain areas? Are there specific needs that are happening in specific or in states, as opposed to it's not happening so much, or different needs in different states? So this is just a very top line level. In 2018, it looks like we worked a little over 200 cases. It was consistent in 2019. So far, we've worked, looks like 88 cases in Illinois, but we are in the busiest time of the year right now, which is open enrollment. I always compare that to tax time for accountants. So the team is very, very busy right now. And just a fun fact, it looks like it's a little over 1,000 people that live in the state of Illinois. All right, insurance issues. I briefly mentioned that this is kind of like our bread and butter. This is really our how we got started, and understanding insurance in this country is so very complicated. Let's move on to the next slide. So we really see this as a two-pronged category. The first is, I just mentioned, just like open enrollment, helping people compare and understand their insurance benefits. There's so much insurance jargon out there. What's the difference between a deductible and a max out of pocket? What's a co-insurance? How is that different from a co-pay or from a co-pay? You know, how do my benefits accumulate as compared to in-network and out-of-network? It's a lot to understand, especially if you're very new to the CF community. We get calls from people all the time who are, you know, very healthy parents, never had to really utilize their health insurance. And then all of a sudden they find out that their child has CF, and health insurance becomes a very, very big part of their life. So right now we're helping people compare insurance options through their employer, helping, you know, looking for plans directly through the insurance companies, comparing Medicare plans, which is probably the most complicated of all of the insurance types, comparing Medicaid plans. So lots and lots of states are moving away from just having what's called fee-for-service Medicaid and moving towards the MCO plans, so managed care plans that are very much structured like an HMO, or looking for plans through the health insurance marketplace. So for your state, it would be healthcare.gov. I think now would probably be a good time to address the question that came in beforehand. So I think someone was interested in hearing about options if a young adult was no longer eligible for to be on their parent's plan for insurance. So there's a couple of different things that we would do during the intake is, you know, looking at the first thing that we would do is, does the employer plan that you were on with your parents, does that have an option for a disabled dependent, which looks very different amongst the insurance companies. So we would call and find out what the criteria is. If that's not an option with the plan, so we could always, you know, if the child has an employer plan of their own as an option, first thing that we would do is talk about what are the coverage priorities. The great thing about what we do here is we try to personalize this service as much as we possibly can. We all know that each person with CF, their needs are all very different. So one person could be thinking about getting a new vest next year. So obviously we would need to look into doing home IVs is very common. So making sure that the coverage for that is good. We always look at all of the covered drugs under the drug list, making sure that the care team is in network as well as any other providers. So if we do what's called a benefit verification with the employer plan and we find out that that's not really a good option, or maybe it's a little too expensive, then we would move on to looking at what's available through the marketplace, or assessing for Medicaid options or any other state programs that might be able to help pick up some coverage. So hopefully that addressed the question that came in a little bit earlier, but if not, I'm happy to elaborate, get more specific if we need to. Otherwise, we can go to the next slide. The other great thing is, you know, we're realizing that people in the CF community, right? Everybody's story is incredible. And we have people who really need some hand holding and going through and just not comfortable with going through the insurance process on their own. And then we have some other people who really want to take the challenge on. They really want to learn more about health insurance and be able to do some of this stuff on their own. So we created a Navigating CF series, so that way you can pick up some of the terms and teach yourself on how to learn about health insurance. But of course, if anything comes up that's still complicated or confusing, we're always here to help navigate. And then the other great thing is during open enrollment, lots of people have, through their employer, maybe 5 to 10 plans that they have the option for. And it's tough to see that side-by-side comparison. Same thing with the marketplace. It doesn't create a great tool for you to compare plans side by side so that you can look at each of the benefits and what the costs are. I know it's very small on this slide, but we have a checklist that we put together for you and send it. We give you an opportunity to look over the information and then schedule one more talk with you just to make sure you don't have any questions or need clarification for anything. So we want to make it as straightforward as possible because we know that this is a very important and very complicated decision. All right, and this has always been where my passion lies. So sometimes even when you enroll in an insurance plan throughout the year, it doesn't necessarily cooperate the way that you had planned or wanted. So anytime that you get unexpected medical bills, some people have more than one insurance, right? So you could have insurance through an employer, something privately, but then also have Medicaid. And sometimes they don't cooperate with each other. And the example of that is, insurance A says that you have to use a Credo specialty pharmacy, but insurance B says that you have to use CVS Caremark. So if you don't use CVS Caremark, they're not going to pay from what's left over from a Credo. So we can kind of step in and get exception processes for that to make sure that we're able to maximize our benefits. Switching or condensing pharmacies. A lot of the CF drugs, they're what's called limited distribution drugs. So there's only maybe a handful of pharmacies that you can get. Or you could be using compounded drugs. So by the time that you're getting your enzymes, taking a modulator, getting home health care supplies, CFRD supplies, and compound medications, sometimes that adds up to maybe 4 or 5 different pharmacies at once, and it's a lot to handle. So we can help try to condense that down to maybe 1 or even 2 is helpful to make sure that you know where medications and supplies are coming from and which places to be getting them from. Believe it or not, there are plans in the middle of the year that will tell you that they're no longer going to cover a specific medication. We see this a lot with some of the more expensive drugs or the specialty medications that, you enrolled in a plan, you looked at the drug list, all of my medicines were on the formulary, and then come May, you get a letter in the mail to say that they're no longer going to cover the drug, and you can't switch insurance plans at that point. So what do you do? At that time, we'd help go through the entire appeal process depending on the type of plan that you have. We can follow that process all the way up to what's called an external review. Also in situations, what happens if you don't have a choice but to enroll in a plan where your care team is out of network? We all know that we have special bonds with our care teams, right? So it's up to us to help tell the insurance company that, hey, I can't just go to any pulmonologist down the street. And oh, by the way, it's not just about the pulmonologist, right? It's about our entire CF care team. It's about the specialized care that we get from our social worker, the dietitian, the respiratory therapist, mental health coordinators. It's really about that really specialized care so we can help get what's called either a single payer agreement or a network exception. And then lastly, just a very simple benefit verification. And I think the situation I had already explained is, if you have a newly diagnosed family member, obviously life just got turned upside down, right? And it's going to be a lot of information, a lot of new things coming at you at once. And that's not even including health insurance. So what we can do is do a benefit verification, make sure that everything that you need is covered, and translate some of that insurance jargon so that it makes sense. Next slide. All right, financial issues. So what this comes down to is sometimes even when you're enrolled in an insurance plan, You may, based on your benefits, even if something is covered, depending on what your deductible is or what your responsibility is for co-insurance. And I'm sure everybody is familiar that oftentimes when you have CF, you're not just taking one or two medications. A lot of the times it's an entire list. And even if your co-pays are $10 to $20, that really adds up when you're taking an entire list of medications. So one of the great things that we do is we make sure that we are connecting you with all of the resources possible to minimize those out-of-pocket costs as best as we can. Next slide. All right, and that varies from anything related to medications, vitamins, nutritional supplements, medical devices. It could be anything from a new nebulizer that costs $100 to any of the new vests that are coming out that range from anywhere from $15,000 to $20,000. So just doing some math there, if you're responsible for 20% of $20,000, not a lot of people have that kind of money just lying around. So we can connect with manufacturer programs and some other nonprofit organizations to really try to alleviate some of those costs. Legal issues. All right. So this is getting to that slide where we were talking about Suffian and Passamano, and if you're familiar with Beth Suffian, she is an incredible advocate for the CF community. She has CF herself, so obviously it's very, very near and dear to her. Suffian and Passamano is located down in Houston, Texas. I think we can go ahead and go to the next slide. Beth is fantastic in her scope of services. She hones in on insurance issues, any issues related to employment or school, disability, social security benefits, any of those types of questions. She really is an expert there. She and her team are happy to answer those types of questions. So we would refer you over to the CF Legal Information Hotline. But we are starting to get some requests about other legal issues. It could be issues with a landlord, or other types of issues within the workplace that may not be able to handle, or if you want to pursue anything legal with an insurance company. There are other legal resources that we're finding and building our database to be able to refer people to still get the guidance that they're looking for. All right, and then the other issues. This is always very exciting because, again, like I said, as long as it's within our scope of services, the sky really is the limit here. And even when we don't have an out-of-the-box answer, we're going to try to sometimes think outside the box and get creative. So next slide. This is ranging from anything, we've seen a lot, especially with the way the world has been over the last 8 months, helping with living and food expenses. Looking for transportation resources. There are lots of great fitness programs out there. They've even been making some changes about getting home exercise equipment. It was always very popular for people with CF to try to get a gym membership. That's not really working these days. So there are some programs out there that are changing some of the things that they do to be able to get some exercise equipment at home. Lots and lots of scholarship opportunities out there. I think I mentioned a little bit earlier that I've never met a person with CF that doesn't have an incredible story, right? So that makes all of these scholarship opportunities extremely competitive. So the thing I always like to touch on there is if you have a family member that's pursuing college, look into what's called vocational rehabilitation services. Every state, every county has an office. It's actually designed to help people with disabilities gain employment. So you put together a plan, go through an intake with one of their counselors, and then once the plan is put together, you can talk about paying for education and or training. So that's one thing to look into for scholarships, and we're happy to do the legwork for you there. But this is just a list of a few things that we might be able to help with. So if you don't see anything here that you might need help with, give us a call, because we can certainly do as much research as we possibly can. And people always like examples, right? So it's great to read slides and kind of explain, the textbook type of thing that of what we do, but people really understand sometimes based on based on examples. So here's a couple that I can go through. We sometimes get phone calls from individuals who are going to study abroad, right? And part of the challenge there is that some of these medications are not available in other countries. So if you're going to be going for an extended period of time, what do? It's almost as if you have to have a family member ship the drug from here. Well, we had an individual going for about 30 days over to Europe, and they wouldn't allow them to take one of their medications. It got held up in customs. So what really had to happen is we kind of figured out what the problem was. All the other medications, he had proof of a prescription. So we really just needed a doctor's note and a letter of medical necessity in the prescription, faxed over to where the drug was being held, and then they finally released it for the individual. Copay assistance for Pulmozyme. So depending on what pharmacy you might be using, Pulmozyme, the full cost of it ranges anywhere from $2,200 to $3,500. That's just for 1 month. So we had an individual, and this is very popular for Medicare for a lot of people, that drug was costing $3,000, and with Medicare, you're responsible for 20% of Pulmozyme every single month with no max out of pocket. So that's $600, and we all know that people on Medicare, they're on fixed incomes. So $600 is a lot of money. We were able to connect them with a couple of different programs to take care of the entire copay every single month. So it goes from $600 to zero, which is a very big deal because Pulmozyme is a drug that a very large portion of the population is on. We received a call from some family members. People with CF, or when they're in school, they like to carry their enzymes with them, based on their schedule, and the school wasn't allowing that. So that's actually a case that Beth was able to step in and kind of provide some guidance and information to make some accommodations there. And then I think I just gave you the example about vocational rehab. There's lots and lots of CF specific scholarship opportunities. But again, if this is something that's coming up in the future, I definitely recommend looking into the vocational rehab offices. COVID-19, we are all familiar with everything that's been going on for the last 8 months. Living with cystic fibrosis or having a family member live with cystic fibrosis, life is already challenging enough, and this is certainly something that's made it even more difficult, right? So we are constantly tracking trends that are happening in the CF community so that we can try to be as proactive as possible. The first place that we are guiding people on our own website, we're constantly updating our FAQs to provide some guidance. If you haven't been there, I definitely recommend checking that out. And then always recommending to keep up with the CDC website as well, so as far as what's going on outside of just CF specifically. So those are two great resources to start with. Obviously, if you've been impacted by anything related to COVID, give us a call. There are some specific resources out there. Let's continue on, David. So again, we've been tracking the types of calls and what's been happening since March. It really started out with people, like the rest of the world, what's my risk to exposure, especially since I have a pre-existing condition. Lots of concerns about going to school or their child going to school, going to work. What's happening with my clinic? How am I going to be able to see my CF care team? What's going on with the foundation events? And other simple things, just as being able to go to a restaurant or go to the grocery store to get essential needs. And then through time, the questions started transitioning about, okay, we know we're supposed to wear a mask, but we can't find any. What about gloves and hand sanitizer, the cleaning supplies? We all know that the shelves in the very beginning were bare. So we started getting questions about how to get access to that stuff. So you can see through the transition of how things have changed, the different types of questions that we're getting. We are constantly trying to keep a pulse on what's going on. That way we can really try to dig into to being proactive with some resources, or to be able to effectively answer some of the questions to put your mind at ease. So since March, we've actually received a little over 900 calls now related to anything for people that have been impacted by coronavirus. All right. And again, just a couple of different examples of the cases that we've been able to help with for people who have been impacted by COVID. Food has been an essential need. You know, lots of people have unfortunately lost their job or had to make the decision not to go back to work, even when the employer was asking you to. You know, the people didn't feel safe going back to work, and ultimately that impacts income. So we've been able to do a lot of research, connect with some great organizations that have been able to help with food on a one-time basis or even on an ongoing basis. There was a family that an individual with CF, that person didn't get diagnosed with COVID, but family members did. So we had to find a hotel for a person to stay in temporarily for a few weeks, just so that person could be safe. So we were able to connect with an organization that could actually help pay the hotel fee, so that way the family could stay separated. And then actually a person with CF, the job situation, they were actually terminated from their job because the employer couldn't make accommodations, and they were asking for the person to come back to work. And obviously this person had to make the decision to say that they weren't willing or they weren't comfortable with coming back yet. So this was a case that we obviously referred over to Beth and her team to provide some guidance. All right, and I know, so that was pretty quick. There's another great picture of our team, but I'd love to open it up for discussion. Any questions, anything that was confusing, anything that I didn't cover?
Thanks for sharing that in-depth overview of Compass services that are offered by the foundation. If you'd like to enter a question, feel free to use the chat feature, or feel free to unmute yourself. We don't have that many people on, so feel free to unmute yourself and pose any questions to Aaron that he could address. Give it a second or two. Well, Aaron, we really appreciate especially the information on COVID-19. I know that's affecting everybody in the world right now, especially our CF community. And we appreciate you and everything that the Compass team does at National. But I don't see any questions coming in. Oh, there is one that just came in from Dawn. Do you pay for any CF related items directly?
That is a fantastic question. So our role is really to connect to resources indirectly. So what we do is we do the research for organizations that can help with your specific need. We also make sure that it's an organization that you're going to be eligible for. The last thing that we want to do is just to blindly give you a website and a phone number and say good luck. Lots of people are capable of doing that on their own, right? So we want to make sure that we're connecting you with an organization or resource that's really going to help with what you need, but we do not provide direct financial assistance.
Excellent. Give it a second to see if there's any other questions.
Absolutely.
It doesn't look like anything else is coming through, so we might wrap up a little bit early, but Aaron, thank you again for sharing all this information as a resource to our CF community. And hopefully everybody will have a safe and healthy Thanksgiving holiday coming up. But I'm sure you probably even had questions regarding Thanksgiving travel and things like that came through. But anyway, thank you again, Aaron. And Aaron just shared his email in the chat feature. So if anybody does want to reach out to him directly, please feel free. Otherwise, I'll share this recording and some of the resources Aaron shared in a follow-up email to all the participants. So thank you again and have a great afternoon.
Thanks for having me, David. Everybody stay safe.
Thank you.